The White House has dismissed the Congressional Budget Office report, which states that 22 million more people would be uninsured by 2026 under the Republican plan. For more now, we're going to head to Washington Post congressional reporter Ed O'Keefe on Capitol Hill to talk a little bit about this. So the vice president will take a shot at making a deal. He's having a little bit of a dinner party tonight with some of the holdouts. How do you see this dinner party going down?
Well, it's important, Anne-Marie, to look first at that guest list. You mentioned Mike Lee of Utah, who's already said he's a no. Also invited Tom Cotton of Arizona, Ben Sasse of Nebraska, and James Lankford of Oklahoma, at least. Telling that those guys are on the list because Cotton comes from a state that has expanded its Medicaid program and is at risk at seeing that coverage upended by this new law. He's been wavering a bit, hasn't been perhaps as supportive as Republican leaders had hoped. Ben Sasse and James Lankford, however, don't come from states that have that issue. So it's telling that those two conservative senators have to be wooed by the vice president at all on this. It shows you the extent to which there is wariness across the Republican conference for taking up this bill. But Pence has been a closer before. He's done this on the House side with the health care legislation over there, where he has deeper connections. Here in the Senate, on the Senate side of the Capitol, he's not as well known, perhaps doesn't have as close a relationship, but as president of the Senate, as leader of it essentially by being vice president, he can use his the trappings of his office, if you will, to bring folks together. Also telling that this dinner is happening tonight and not perhaps last night. That suggests that there may be a delay here in getting the ball rolling on this bill. There's supposed to be a vote to proceed today. With so many senators holding out, however, they may have to push it into tomorrow and push back the calendar a little bit on consideration of this bill.
Well, that was the question that I was going to ask you. We know now at least 6 senators say they don't like the bill. Several have said they're even against a vote that would bring it to the floor just to start debate. So if the lawmakers won't even begin debate, they don't even want to talk about it, what happens next?
Well, conceivably, it could go back to the committee level and it would be handled by committees like the Finance Committee, Budget Committee, Health, Education, Labor, Pensions Committees, and they could work on some kind of a new deal, and perhaps take a step back, take a breath, and see if there's a way to come back to this. Otherwise, maybe Mitch McConnell and his leadership team decide, no, it's dead, it's over, we have to move on to tax reform. We'll have to do some new math on that because we were expecting some savings from this. And we'll just plow ahead. But tax reform really is the next big thing they want to move on to. They've got to consider things like raising the debt limit. There's going to need to be a budget passed by the end of September, and a host of federal programs need to be reauthorized as well. So there's plenty of difficult work ahead for Congress as a whole. The longer health care festers, the harder it will be to get that other work done, which is why we may see here, if they can't proceed, a decision to abandon it entirely or at least put it off until later this year.
Yeah, and one of the major points of contention when it comes to this new bill are the cuts to Medicaid. And certainly representatives of the White House have characterized them differently, saying they're not cuts. It's more of a slowing down of spending money. But I'm wondering, is there a compromise in the works? Because this is a really big deal. And a lot of these people who would be affected are people who voted for Donald Trump.
Exactly. And look, one of the things already changed in this bill is that the changes to Medicaid would happen over a longer period of time. It wouldn't be as abrupt. There have also already been some changes made in the bill to appease certain senators. There's a change that essentially benefits the state of Alaska, where there are a lot of lower income people who benefit from Medicaid. Lisa Murkowski got Mitch McConnell to include some language that would essentially exempt Alaska from a rule that would require more generous states with their Medicaid dollars to send some of that money to other states or to have it be redistributed. She was trying to get Alaska exempt, and the way she did it was by getting language in there that essentially says any state that has fewer than 15 people per square mile on average would be exempt from this law. Well, most of Alaska, of course, as gigantic as it is, isn't packed with people. So essentially Alaska would get a break from that bit of the Medicaid changes. We'll see if there are any other changes like that inserted here in the next 24 hours or so. Conceivably, there could be. But where we're likely going to see changes made is not necessarily to Medicaid, but to other parts of the bill. There may be more money put aside, for example, to help fight the opioid crisis. That's been a big priority for Rob Portman of Ohio and Shelley Moore Capito of West Virginia. You may see some other changes into what extent Obamacare itself gets rolled back. That would fulfill the requests of conservatives like Ted Cruz and Mike Lee. And maybe there's some other state-specific thing we haven't heard about just yet that comes up. Remember over the weekend, for example, Bill Cassidy, the Republican from Louisiana, told Face the Nation he had state-specific concerns for Louisiana. So maybe there's some kind of change there that would benefit them.
Oh, the side deals. Who knows what this piece of legislature will look like once it's all said and done. Ed O'Keefe on Capitol Hill, thank you so much.
Great to see you. Take care.